Our sustainability story is that all of the people that receive benefit from the health information exchange pay into it. The hospitals pay in, the labs pay in, and the providers, the users pay in to it on a monthly basis. And we set it up to be as low cost as possible. When we got started, there weren't any grants available, so we had to bootstrap the organization and keep the monthly costs at a reasonable price for all the providers. I think the other piece of the sustainability is offering a rich set of services that are attractive to the users. We built the business on a number of core services like many other HIEs, meaning labs, radiology, and transcribed reports, and then also enhanced it over the years in terms of moving data back and forth between providers, such as referrals between providers, pre-treatment authorization requests. We offer a transcription service that works with the health information exchange and with the doctor's EMRs, and that both brings a revenue model in, but it also is it's a sticky application, meaning that it's something that brings the providers back every day to use it. Well, I think the major challenges that we have, even though we've been in business a long time, is that we don't have 100% of all the data. There's still too much data that exists out there in paper records or in systems that aren't able to connect in a standard fashion, meaning HL7. So we have an effort that has been going on for many years to reach out to providers and facilities and get them to allow us to help them convert that data into a form that can be stored electronically as a HL7 message and move through the health information exchange. Well, California has a state-designated entity called Cali Connect, and I'm involved personally with that effort. And certainly our health information exchange expects to be consistent and connect with that Cali Connect as they develop their core services. We're really looking forward to some of the core services that they're looking to put together, such as the entity registry and the service directory, as well as potentially a clearinghouse, a lab clearinghouse. We also have a REC in our area named CalHIPSO, and my organization has technical expertise in implementing EMRs and connecting them to HIEs, and we've applied to be a service partner to CalHIPSO and expect to use that money to help bring more providers, especially those PPCPs, to meaningful use. Yeah, we see engaging patients as a key thing going forward. So far, we've not really engaged patients, not nearly to the degree that we've wanted to. We have plans to use the PHR gateway capability to connect the health information exchange data to the patient's personal health record, and that would all be under the consent and control of the patient themselves. We found that those technologies really are just beginning to mature to the point of being really valuable to the patient. So in 2010, here later this year, and 2011, we will be doing some pilots to connect personal health record gateway. We think that that's a better solution than one that's tethered to an EMR, because it would give a community-wide or an all-provider view of the patient's data as opposed to just what's in that patient's EMR at a particular doctor's office. The vision that we're pursuing is to have a doctor, a healthcare worker, be able to do virtually all of their work within the tool that's in front of them, their EMR or whatever tool they are using, meaning that the data needs to meet at that point. The notion that a provider or a user would need to jump to different applications, different portals to get pieces and fragments of the data electronically is fraught with peril. We've seen this launched many times, where an organization will launch a portal with a piece of data on that's very valuable to them. However, what's really valuable to the provider is to be able to have all of that data in their system under their control so that they can trend it, They can do alerts based on it, and they can treat the patient better based on that type of aggregation of data.